Welcome to episode 5 of Path to Med. I'm your host, Suhani, and my guest today is Dr. Anthony Davies. He's a comprehensive academic family physician in Mississauga and also an assistant professor at the University of Toronto. He's the medical director at Bridgeport Medical Clinic and a clinical associate at the Center for Addiction and Mental Health. Dr. Davies holds a Master of Science and a postgraduate diploma in pain management. And with over 5 years of experience in medical education, he's dedicated to mentoring future physicians while providing compassionate care. So it's really nice to have you on today's episode.
It's a pleasure being here. Excited about being on your program. Thank you.
So, just to start off the interview, what inspired you to pursue a career in medicine?
My teachers initially, because they all kept telling me I should be a medical doctor, and of course at home, always playing the doctor. Those were my early inspirations of a career in medicine, or the ideal of medicine, that of helping people in need. So I got into medicine as a calling, I should say, because I really wanted to help, and I thought that was where I could do the. This is right. I really wanted to become a medical doctor.
So, you kind of always knew that it was something that you were interested in and wanted to do then, right?
That's correct. My teachers, and then my friends, my parents guided me, and then my medical teachers in medical school.
So, you started off your career in Nigeria, I believe, and then now you're a family physician working here. So, do you think you could talk a little bit just about your career path and also, yeah, like your experiences being like a family physician in Canada?
Yeah, that's a great one. So my career path has never been like linear and straightforward. It was met with, several hoops and obstacles. The challenge of being an international trained, foreign trained doctor is you come to a country like Canada, and you have to write challenge exams and get your licensure, registration. So it is a process, and one that I took on very, with support of my family, of course, but I took on the challenge very well, and was able, after a couple of years initially, mind you, I landed in Canada in 2009. It was a cold December day in Winnipeg. Winterpeg was the informal name, and then other exams followed one after the other over a couple of years, and finally in 2013 I was practicing as a fully licensed physician. Started off in Manitoba, like I said, and then ended up in Saskatchewan after a few years, and then in Alberta, and finally in 2018 moved to Ontario, where I've been since. And it's always been my passion, of course, to also teach. So that's how I got into medical education. But again, back to the question, it wasn't a straight, easy road. Was met with a lot of challenges. So what I would say to students and other aspiring doctors is that the road is not going to be easy, but you're able to rise up to the task, and every time and effort you put into it will be worth it in the end.
I mean, yeah, like as you said, the path definitely wasn't linear, but you've taken on like a lot of different like roles and opportunities and things. So, how did you kind of find these opportunities and what are your like experiences doing some of these like other projects and things?
Awesome. Yeah, so first it was need of my patient. So when you work in a small town, a small hospital, there'll be needs specific to that small town, specific to the hospital, and that's how I got involved in the different areas of medicine that I got into. In a rural hospital, it's very hard to recruit specialists. So if you recruited an OBGYN, for instance, all they would be doing is delivering babies. There's only a few. I worked in a small town of about 500. There's so many babies you deliver. So specialists don't thrive in the small towns as do general practitioners who are able to do a little bit of everything. So you have a lot of work because you're not just doing catching babies or delivering babies, as we say. So I got involved because of the need. My community needed somebody who could help out in the operating room. So I got involved in that. They needed somebody to run the emergency room. I got involved in emergency medicine. Similarly, pain was a big issue. I got involved in safe prescribing of opioids and also addiction medicine following that. And yeah, so every different role I took on was, I believe, trying to meet a particular need in my community, in the patient population I serve. So something to keep an eye on to our aspiring doctors is take on roles, opportunities that will help you be of better service to your community, somebody that will be a go-to person, even a consultant to your other colleagues where they come to meet you and ask you about, oh, what do I do in this instance? So we all need to, play our different roles very well and work together as a team to support our local community, our local hospital, and of course our colleagues. So that was my major motivation for embarking on these different roles, was really to be able to provide services that were needed by my colleagues. Along the line, I did get satisfaction from learning a lot, from getting the accolades after my name, but yet that was not really the main point. It was really to be able to be competent in different areas to help out.
I guess well-rounded and like knowledgeable in yeah, different areas.
Absolutely.
Obviously, you had a lot of experience prior to coming to Canada working as an anesthesiologist. So, without that experience, would you have still kind of had the same opportunities that you had in Canada in terms of your work?
I'll say yes and no, so it depends how you see it. But certainly, having worked in a variety of settings and already been through a postgraduate diploma in Nigeria, certainly helped me launch my career in GP anesthesia in Canada. Of course, that was also, I needed to do more training to get up to speed with the practice in Canada. But yeah, it actually set me off on a good footing. Back to the question, really, even if I didn't have that prior training, in the kind of person I am, I'm bored doing the same thing over and over. I needed a lot of different things to do to keep me occupied. I would still have pursued interest in various other things. It just happened that I started off in anesthesia, but also branched out in emergency medicine, in addictions, pain management, and then medical education. So if one is versatile, resilient, you'll see opportunities out there that you might align your interests with the interest of the community. So you have to get skills that will help make you useful and contribute to the community.
I mean, yeah, you definitely gain like a lot of like a huge variety of experiences and skills compared to like most family physicians. So, for you, what does a typical day kind of look like as a physician?
Yes, that's the question I'm asked the most about my life as a family physician. My days in the clinic starts at 9 o'clock and ends at 5 o'clock, but that's not nearly all the work you do. There's work you have to do before that time and then even after. For instance, I'm staying behind in the clinic now to talk to you and of course finish up my notes, look over reports. After this call, I'm going to call one or two other patients to kind of touch base with them, report on results and follow-ups. So there's all this work you do before and after, up usually at around 5 o'clock. That time between getting up and when my three boys, young boys, when they wake up to get ready for their school, that hour or two I get before they wake up is actually to help me, get into my flow, reflect, study a little, catch up on my charting, prepare for my day. So these days I try not to take work home, but sometimes it's just kind of inevitable. You have a very sick patient, you want to call back to the unit to see how they're doing, you want to follow up because you're responsible for residents or medical students to see if you're needed in any areas. You get all these calls throughout the day and night. It just comes as part of the work. For the most part, though, I have a 9 to 5, so at 9 o'clock, I start seeing my first patients. The patients are scheduled every 15 minutes, so in an hour, I'm seeing 4 patients. So if you do the math, I'm seeing upwards of 18, 19, 20 patients by the end of the day. I do have responsibility for supervising residents and medical students, so sometimes, yeah, I'm drawn to other clinical rooms or situations to provide that supervision. So at the end of the day, I've seen maybe 30 to 40 patients in a typical day. I do reserve my lunch hour between 12 and 1 o'clock to again get some food to eat, sometimes some meditation when I'm able to throw it in, walk, go outside, get some sunshine and fresh air, and yeah. And then I get ready to start again at 1 o'clock, and it goes on again until 4 o'clock or 5 o'clock, and then stay behind to tie up loose ends. In terms of the distribution of patients, I see all kinds of patients from very young ones to very older senior citizens. So from newborn babies, sometimes just a day old, to my oldest patients will be in their hundreds, right? So I do have such vast responsibility. I see all sexes, women, girls, boys, different genders, transgender, LGBTQ individuals as well. I make a point to advertise that I see everyone, so as not to exclude anybody. I'm sure sometimes I unfortunately fail in that area, but I do make a conscious effort to be equitable and see different economic strata in yeah, other things I do during the day. There's procedures. Sometimes, like today, somebody comes in, they've had a stitch or two in the emergency room. It's been a week or two, and the stitches need to come out, so I take it out. Or for preventative care, people need their vaccines. Unfortunately, I have a nurse I work with, so she's able to give the vaccines, but sometimes I'm calling to help to give an injection or two. I'm calling to help with a pap test, although I have a nurse which usually does that, but sometimes I'm calling to do that. And the physicals are ones also done throughout the day. So we do have a variety of appointments. Some last just 15 minutes, as the typical appointment is, but sometimes I have to double book to see a patient for longer than 15 minutes. So you got to be flexible with your schedule, and you have to kind of be a go person, just because the work is fast paced, and yet you don't want to miss out on fine details, pay attention to details. Of course, we're in the business of taking care of lives, so any careless mistake can be fatal. So you also want to be, paying attention to details, and it's just not numbers. You're really taking care to be careful and to provide safe care. That's the summary of my day, and usually I'm going in to bed about 10 o'clock because again I wake up very early, 4 or 5 o'clock at the latest, and it starts all over again.
You mentioned that you're someone that like doesn't like repetition, that you get pretty bored. So it sounds like you see like a really big group of
Quite
people, which
variety.
is great.
Absolutely.
There's a shortage of family doctors in Ontario, but even though this is the case, a lot of family doctors are still leaving their practice. So, in your opinion, what do you think is kind of driving this?
In one phrase, is the physician burnout? Although some people have also said that people lose their joy in medicine. which again feeds back to the physician burnout. People say is compensation, is salaries, is overhead, or is paperwork. But in my experience, I think most people are able to, face up the challenge of paperwork, administrative burden, or whatever. Mostly is that physicians lose touch with the purpose, the reason why they're in medicine in the first place. They forget how they got into this profession, and they forget to take care of themselves, they forget to take care of their families, they're oftentimes too engrossed in the work and not really enjoying the caring for people. Patients don't care what you know, they don't care how many degrees you have. They want to know that you care, and oftentimes caring for other people is the best satisfaction you can get out of your job, not the compensation, not the other perks of the office. So in my experience, it's really the physician burnout, and we're seeing that even in our medical students. There's medical student burnout. We're seeing that in our residents burnout, which is why the focus in the last couple years, especially during COVID and post-COVID era, is wellness, physician wellness, medical student wellness, resident wellness. So there's retreats. There, for example, I'm just back from this weekend attending one of those retreats, which kind of gave me a break in my regular practice. Spent time with other colleagues, and we just had fun, talked about medicine a little bit, but there were other things we talked about that had nothing to do with medicine. Eat together, play together. As you know, they say a team that plays together works well together. So these are all aspects to combat that physician burnout and compassion fatigue that we often see robs people of their joy, and they forget the purpose why they're in medicine in the first place. So that's my 2 cents in a nutshell.
It sounds like you have a pretty healthy work-life balance, which I'm sure is really important, especially if you're working as a physician. Would you say that like the compassion fatigue and the burnout is like also there in other specialties, or like family medicine like especially?
Reports that have come out, especially from the US, where they've studied this, to say that it is high in the medical specialties compared to the surgical specialties, psychiatry, for example, but family medicine, because we do a little bit of everything, is definitely high. The good news is in the last year or two, when you look at the statistics, the reports now are showing a downward trend in the physician burnout rates post COVID-19, and people are starting to rebalance and refocus their priorities. So we're hoping that this trend continues.
So, given the compassion fatigue and the burnout, but like also on the other hand, you have like the variety and like kind of the pros of being a family doctor. So, kind of like weighing the two sides, would you recommend family medicine as a career option for like students?
Yes, for two reasons. One of the reasons being it is a very fundamentally caring profession. So if you're cut out for this kind of work, caring for people, then the best place to get that satisfaction, caring for a wide variety of people where you can actually do a lot of good, is family medicine. All right. And the second is that as family doctors, you are constantly learning. So vast opportunity to learn, to grow, to get into various roles in leadership, in administration, in service, academic medicine. For example, you can combine being a professor with being a physician. Like there's all these opportunities. Family medicine presents the best of all the worlds, or all the spheres of life you can really aspire into, and there's more spheres and more opportunities coming every day into family medicine. So I recommend it not just because I'm a family physician, but because I know for people who want to do the work and who want to enjoy the satisfaction of being a of being a physician, the place where you do the most good is actually in family medicine because of the wide scope of practice and the endless opportunities that presents itself.
It sounds like a really like dynamic and changing field. So I'm sure like the path isn't linear for everyone too. There's like so many options that you
That's
can
true.
kind of pursue afterwards. So, how would you say practicing medicine in different countries has like changed your perspectives as a doctor, if it has?
Yes, it has. Practicing medicine in all these different countries has made me understand that human beings are human beings everywhere. The practice of medicine itself is easy. What I always tell my resident is the dealing with the human beings, those soft skills, those communication skills. And having practiced in Africa, in the Caribbean, where, there's that paternalistic relationship between patients and providers, between patients and doctors, and then coming into cultures like in North America where patients are seen as equal partners, if not the main partners that are at the center of care, that we have to, do shared decision making with. We have to get their informed consent. We have to respect their autonomy. I've seen either side of the spectrum, and certainly want to advocate for patient-centered care, and they have to work on the communication skills and giving patient that ideals of patient autonomy, self-determination, respecting patients' feelings, their ideas, honoring their expectations, setting a clear patient agenda with the patient. So these are all things that I struggled with initially, and I found better ways to communicate with my patients, better ways to show empathy, to show caring, and to take patients' feelings, ideas into my plan of management and actually come to a mutually shared decision making.
As a family doctor as well, you're kind of at like the forefront of medicine. You're the first physician that like a patient will see if they have some sort of like concern or question. So you mentioned that you're involved in medical education. So can you tell us about your experiences with that and also why you kind of decided to get involved with it?
I've been involved in medical education right from the beginning because as a medical student, I was always interested in getting my colleagues in a small group to discuss our either basic medical science questions or clinical medicine. So I always loved the fact because I felt if I understood it, then I should be able to teach it. And if I teach it, I understand it better. So I had that selfish motivation for that initially. But of course, I have soon found that I enjoyed it. I found that it was a great way to, work with your colleagues and start practicing to be a doctor even before you became a doctor, even while in medical school, get cultured to thinking like a doctor and stuff like that. So with medical education, then I definitely enjoyed the ideals of discovery, innovation, inquiry, asking questions, and applying the scientific method for teaching, learning, pursuing evidence. So we talk about evidence-based medicine, which is really merging the data with the science, and of course your expertise as a clinician, and then the patient ideals. So all this really boosted me to continue to pursue medical education and seek formal training in it, and then get into faculty roles with the University of Toronto, for example, and pursue faculty development where you're constantly learning and applying new information, curriculum development, is another aspect, as well as assessment and simulation teaching or learning. So these are areas that I've also tried to kind of diversify my practice. So I'm not just in the classroom, I'm also in medical education to aspire future physicians and to guide them in their career choice.
You mentioned that if, especially family medicine, you kind of have to like constantly be like learning and evolving your skill set. So,
Correct.
I mean, this is kind of like a prime example of doing that. So, how would you say you kind of maintain a work-life balance, and kind of like manage stress in your profession? Because you mentioned like family doctor burnout is a huge factor to turnover. So, how do you kind of prevent that?
Yeah, I kind of alluded to it earlier on when I said I kind of have day time during my day to kind of, do different things and then make time to get a break from my usual routine, like what I did this weekend, to go on a retreat with other colleagues, other doctors, and just have a weekend of fun-filled activities, meditation, and stuff like that. It's always hard to have doctors together and not talk about medicine. So we talk about medicine a little bit, but we make a conscious effort to play. Went to the baseball Blue Jays game on Saturday. So stuff like this, you have to make time to do these things that seem like, it's just a waste of time. I should be, inventing some new therapy or something like that. Important that you are using a downtime to just, play and be, you know, carefree. I try to do that by looking for these opportunities, a weekend retreat, faculty development session, sometimes even online between 8 o'clock to 9 o'clock before I even start my day, or during the lunch hour between noon and 1 o'clock. I oftentimes will spend, an afternoon of that. It doesn't cost a lot. You don't have to travel to do these Zoom events. And then when you get together with colleagues as well, you can discuss cases right in the hallway. Something that's on your mind. You can say, "Oh, what would you do? What would you have done in that instance?" And you can get useful tips from your colleagues. That way, you don't feel like you are alone carrying the weight of the world. So these are all practical strategies to incorporate wellness and to integrate work and life. Because guess what? Work or life doesn't just stop for, it's kind of not mutually exclusive. It happens all together, which is why instead of work life balance, we're saying work life integration, how you can seamlessly weave in and out of work and life and just enjoy yourself rather than wait until age 65 and then take a vacation or take retirement. Rather, while you're working, you can still be enjoying everything you hope to achieve or do during retirement. You can still be doing that during your work life. You don't have to wait until retirement age, for example.
Medicine's obviously a really demanding specialty, but yeah, I feel like, if you kind of maintain that balance, it makes like the workload a little lighter, more manageable. So
Absolutely. And like I say, more than the balance is the
it's
integration,
the integration.
finding a way to work and yet live your life, and not wait until,
You
when
shouldn't
all
have
my
to
work
like
is done
quit.
and then I will take a vacation. No, the work will never be done. You'll have to find a vacation during your working, time or something like that. Yeah.
I mean, yeah, there'll always be work to do,
There
but
will always be
obviously
work and there will be more work in the future.
this is kind of specifically for students that are kind of considering going into medicine. But what advice would you give to students that are kind of anxious about like the lengthy training it takes to become a doctor? Because obviously you have your undergrad and then medical school and your residency. So you kind of start working like way down the line. So
Excellent. So I come from it from two angles. I'll come from it from a business angle and I'll come from it from a professional angle. From a business angle, uh, it wouldn't matter whether you train for 10 years or 15 years. to make financial success or financial sense out of your career in medicine, because you want to do what everybody will, hopes to one day retire and, in relatively good shape, plans that will sustain a retirement life, which is you want to be saving and you want to be investing right off, getting off of high school, for example. And I say that because it wouldn't matter whether you're going into plumbing or mechanical engineering or being a high school teacher, for example. You'll need to start saving and being smart about your money, investing, because at the end of the day, your investment in life will help assure that you are able to pursue your goals in life later on. So that's the business aspect. Then, from a professional aspect, it is so not an arduous task, because if we compare other countries, for example, in the US, for example, family medicine training is 3 years, and you still have to go through high school, still have to have, an undergrad degree or at least some kind of college advanced degree, depending on this institution or medical school you're applying for, sure. And every single time you spend in residency trying to become an independent doctor is well worth it, because you'll be already working and you'll be already growing your knowledge and growing your skills, growing your professional attitude. So it's not any time wasted at all, and you'll get compensation. But as you know, anybody who is at the top 1% of their career or profession is also because they've spent a significant amount of training in that profession, and they've gathered a lot of years in work experience. So it doesn't come easy, any profession, and medicine is not an exception. So basically, I hope I've been able to debunk that myth that we're spending way too much time training. What we should be doing is really planning ahead and start saving and investing as soon as possible in your career, whether you're going to go into medicine or not. And if you do get into medicine, every year, every day counts in making you the best professional who's going to be the top of their game in the next 5, 10 years.
You've obviously been practicing as a family physician for a really long time. So, how do you think like technology or kind of changes in the field have changed your practice since?
Yes, the most recent technology that's been the world of good to my practice is what we call AI scribe, which is the artificial intelligence scribe, where I can see my patients and don't worry about documentation, because the AI is in the room with me and all my documentation is done as soon as I'm done with the patient. All I need to do is just with the click of a button, all my notes are transferred into the chart. So that's the big game changer for me and for a lot of my colleagues, because we are seeing that this technology is reducing our time with documentation, paper charts. There's up to reports of 90% reduction in time spent after hours, doing work in your pajamas at home when you really should be spending time with family. So that's the most single impactful invention that has changed my practice, getting artificial intelligence to help with my documentation. And in the future, we'll see AI come into management, helping us, make diagnoses, order tests, figure out what's the diagnosis, what's the differential diagnosis, what are the next steps for the patients, next steps for the physicians. So we're going to see ever more incorporation of artificial intelligence into medicine. Will our jobs be deleted in the next decade? I don't think so, because we're always going to need physicians who can think. Physicians that are going to lose their jobs are physicians who are not using AI, are physicians who are not in tune with the technology, in tune with the latest AI enhanced technologies.
I'm sure it's important in like any field to kind of stay up to date with tech. It just helps you in the long run, obviously. It kind of like reduces like, some of that paperwork.
Correct.
Right.
Yeah.
Yeah, but I feel like, yeah, medicine is kind of one of those careers that can't really be replaced by AI. I feel like it's always going to be relevant. Like, you'll always need a human family physician.
Absolutely. Absolutely.
So, just to finish off the interview, if you could go back in time, what advice would you give like your high school or university self about pursuing a medical career?
I'll still say to myself, go for it. Go for it. Go for medicine. Be brave, be courageous, be strong. Not always easy. You're going to fail some courses. You're going to have to repeat them. You're going to fail some clinicals. You're going to have to repeat them. You're going to meet some great teachers. You're going to meet some not too great teachers. You're going to meet some really great classmates, some not so great classmates. But you're going to have to get along with people because that's the real world. The real world is going to be working in a team. You're going to meet different people. Some will like you, some will not fancy you so much, but you got to get along with people, be professional with people, be respectful of various perspectives, various ideas. So I'm going to say to myself, just brace up for the future because it's exciting and started off in in Africa, nowhere, ended up in Toronto, and part of a big family medicine teaching unit, part of University of Toronto, which leads all other Canadian universities, medical schools in terms of innovation, education, scholarship, discovery. So yeah, the future is can be predicted. So work hard, pay attention to details, put in the time, and yeah, the road is not going to be easy, but you'll have satisfaction in what you do if you stay true to your ideals.
The road isn't easy. It's not going to look the same for everyone either, but I
Oh,
mean, that's just how life is.
that's true.
Yeah. Well, thank you so much for taking the time to do the interview.
It's been a pleasure, Suhani.
This is so, so, so helpful. So, thank you so much.
Let